I just want to show you some before and after pictures. This is a client of mine who had inflamed acne, and we used Mandelic on her, and coupled with benzoyl peroxide. Inflamed acne their skin tends to be a lot more sensitive, so you really have to be careful about testing the serums on them. It's the interesting thing, too, about the use of benzoyl peroxide is it will make the skin less sensitive over time. It's uncanny how it works that way. So even if their skin is so sensitive that you can't use a serum on them, like no serums their skin will tolerate, put them on a low-dose benzoyl peroxide, like my lowest dose is 2.8%. And after a month of having them just use the benzoyl peroxide in the evening, test their skin again. Test them every time they come in, and you'll be amazed at how much less sensitive their skin gets. I'm not sure why that happens, but it seems to be very consistent. This is a case of pretty severe non-inflamed acne. So what I again start them off with Mandelic coupled with the use of benzoyl peroxide. But after about 6 weeks, I will add in a vitamin A propionate serum. I don't add in the vitamin A propionate serum in the beginning because vitamin A is one of those ingredients that will purge the skin. It doesn't happen on everyone, but it will. You will have a much less chance of the purging, inflammation coming up. If they have been on an antibacterial like benzoyl peroxide for the first 6 weeks. So I will, after about 6 weeks, their third or fourth appointment, I will test that vitamin A propionate serum on their skin, and if it's tolerated, I will have them use the Mandelic in the morning, the vitamin A at night, and then the benzoyl peroxide. And I always tell them to wait 15 minutes in between that vitamin A and the benzoyl peroxide. So this is how we got our non-inflamed acne client clear. This is combination acne. What I do in this case is I treat them as if they were inflamed acne first. So with her, I'm going to use a lot of antibacterials. I'm going to use, again, the Mandelic. I'm going to use the benzoyl peroxide. Probably have her use the benzoyl peroxide twice a day at some point. Then the inflammation tends to go down pretty quickly. So once we have the inflammation down, then I will start treating them like they're non-inflamed acne, and it almost always takes longer to get the non-inflamed acne under control. But once the inflammation is down, then you can really start pushing the skin. So let's talk about acne imposters, those skin conditions that can look just like acne. Some are treated the same as acne, some are not. Some will not respond to acne products at all. Believe me, I knock my head against the wall with some of these acne imposters. So I want you to learn how to recognize them so you don't go through the same torture I did with them. The first one is called melasthesia, formerly known as Pityrosporum folliculitis. And I'm talking about the fungal form of folliculitis. There are many forms of folliculitis, but this is the one that I see the most in my clinic. It's a fungal, yeasty type of skin infection that can look exactly like acne. It can be brought on by sweating, by friction, by clothing. I know when I still was acne prone, every once in a while, I would get these red dots on my chest that would just appear out of nowhere, and then just as mysteriously they would go away. And I realize now that that was folliculitis. So how can you tell that it's folliculitis and not acne? Because sometimes they have both. They'll be both folliculitis and acne. So the way I tell that it's folliculitis is how it extracts. If it is an acne impaction, like a blackhead, you'll get a core. When you extract it, you'll get a core out. You'll get the whole, looks like a little seed. With folliculitis, it'll extract, but just a little bit of material will come out. You won't get an entire core out. And you'll learn to see it. Another thing you can do is ask your clients, when you see these bumps, you go, You know, these bumps on your forehead, do they just come and go? And if they say yes, then you can, it's probably folliculitis. Acne is not like that, especially non-inflamed acne. It doesn't just come and go. So, if they do indeed have folliculitis, then you can use antifungal ingredients on it. It does not respond to benzoyl peroxide at all. This client that I have here, I had her on really strong home care for non-inflamed acne for months. I don't think I was using Mandelic back then. And her forehead just would clear up. And then I finally did some research and realized that this might not be acne. Put her on some antifungals, and sure enough, her forehead started clearing up. So the antifungal ingredients again: Mandelic, ketoconazole, and zinc pyrazone. Ketoconazole you used to be able to get over the counter. We would tell our clients to get some nice oral shampoo. It had 2% ketoconazole in it, but I think that it just recently became a prescription product. So we're still looking for a supplier. For the folliculitis to clear up, you know, sometimes it will respond right away, and sometimes it takes as long as acne. There's no real consistent time frame with that. Yeah, good question. Another one that I really want you to be able to recognize is a staph infection, because it can look just like acne, but it's like super acne gone wrong. One of the main ways of being able to tell that it's not acne, because an acne lesion, a pustule or a pimple, oftentimes have regular borders. If they have a staph infection, those borders are big and they're irregular looking. So if you have any suspicion at all that this is staph, do not touch it. If you really don't want to try to extract this, staph is highly contagious. You want to send them to a medical doctor ASAP. And even if you might not know for sure, but you have a suspicion, send them anyway. Have them get tested by a doctor and have them be treated medically for this. Steatocystoma multiplex. I practiced that so I could say it. This seems to be quite a rare disorder of the pilus sebaceous glands, but I have seen like 4 of these cases walk into my clinic, and I had 2 clients for quite a while, and I thought for sure it was some sort of weird non-inflamed acne, and I was going to fix it, but it just it looks like inflamed acne, but it's not tender. It's these, it's a disorder that's characterized by too much sebum being created. And so it forms these cysts. You can sometimes drain them, but it'll just fill up again, and there's, at this point, there's no known treatment for it. My clients who have this, they still like to get treatments from us because it just makes the rest of their skin look better. We'll use the vitamin A propionate on them. And sometimes it will be coupled with acne as well. I had one client come in who had been to several dermatologists who told her she had acne, and when I looked at it, I go, no, that's not what it is. It's this steatocystoma multiplex. And so then she could at least know that there were no products that were going to help to get rid of it. So she could then deal with it that way. So let's talk about extractions. I'm going to go ahead and get my model set up, and we'll get a demo.